back, everybody, to Pivot Point of View. I'm Destri Millsap, along with Becky Pearson. We've just had a run of great guests with Jade Trump, Jimmy Beth Powell, Jimmy Nichols. Basically, if your name starts with a J, we've had you on. But we really enjoy them, and if you haven't heard those episodes, go back and listen to them. They're all really great, and hope you all enjoy them. So today we are going to talk about knee pain. And so a lot of people, we've talked about hip pain, we've talked about back pain. Today we're talking about knee pain. So Becky, whenever you are doing an eval on somebody, what are some of the areas that you would check and some of the signs and symptoms you would look for if you suspect someone has a knee issue?
That's a great question. So I like to take a look at them with shorts on. I want to be able to see their knee. I want to see them out of shoes. I want to see what's going on at their ankle. I want to see what's going on at their hip, because I really feel like a lot of times the knee gets caught in the middle between a battle between the ankle, like ankle and foot pronation, so their arch dropping, and then a weakness in their hip. And so I think that all plays a part. The whole patient really does play a part in how the knee functions. And so we're not just looking at the knee, we are looking at that whole lower half of their body. What's going on at their pelvis, what's going on at their hip, what's going on at the knee, what's going on at the ankle. And then, doing a functional screen like we've talked about in our other podcasts of how are they moving? Are they able to bend? Are they able to squat? Are they, what does that all look like when it moves together with the hip and the knee and the ankle? And so that's kind of where I start. And then from there, we dive into what's their range of motion at those places, what's their strength, and we try to come up with a game plan from there. How about you?
Yeah, I would totally agree with looking at the body as a whole, especially when dealing with a overuse type injury and trying to figure out why this is happening. So just like in your horse, if your horse's angles are off in its foot, it's going to affect everything up the chain. We know that, and it's no different in the human. And so the ankle has to be able to flex, bend, in, out, rotate, all those things. And if it can't, you're right. The knee is taking a direct hit. The hip is taking a direct hit after that, and then it just goes downhill from there. Other than that, it's looking for swelling, loss of range of motion, and then of course our special test with the injuries that are more traumatic and stuff like that when we're dealing with ACLs, meniscus, even patellar dislocations, all the things, using our special tests to try to rule out certain things. But the major red flags for me are definitely swelling and loss of range of motion. And with those two things, it's a pretty easy referral.
Yeah. And so, for example, we were talking before we went on air. I did a knee eval this morning of a tie down roper. He's also a football player. He got hurt in football. And, as he's describing his mechanism of injury, which was he stopped, planted, and pivoted. I was really afraid of an ACL tear is what I was worried about when he talked to me about that. Because that is, don't you agree? Like that's like the most common way for kids to tear their ACLs in a non-contact injury is kind of that plant, pivot, shift, sudden stop type of a thing. And so that was my first concern with him. When you see an ACL tear on the field or in the arena, what are some of the things that stick out to you right away when you see those, Destri?
Well, you said the mechanism of injury is a big thing, and especially if it's a non-contact deal. And we see them in the goat time, we see them in the tie down roping and everything else that they get off, they take a wrong step, and their knee gives out, or they hyperextend, or something like that. I mean, those types of things are pretty common. And so when we get to them, we're asking them where they hurt. We're checking the knee. We're looking for fractures, making sure that we're ruling out fracture, making sure that they can move their foot, they got feeling in their foot. Because anytime you're dealing with a lower leg injury, you want to make sure that they are still getting blood flow through that limb. Even if you do suspect an ACL tear, they can still have compromised blood flow. So you want to always check the distal pulse and make sure that everything's good down there. And then of course our special test. And so the first thing that I'll do is a Lockman's, and it's crazy if you feel 100 good ones, when you feel that one that is torn, it is night and day. There is no question. And the quicker you get to them and you're able to check that, the probably the better test you're going to get. So the on-field ones, I mean, you just know right then, that when you do your Lockmans, it's going to separate quite a ways, and there's going to be no infield there, and you know right away that it's an ACL tear, and you're going to get it immobilized and get them to the next step and get them checked out. So
Now, if you
the
do that a couple days after, though, now, because a lot of these people don't come, like this kid, he didn't have anything done for this injury happened on Tuesday. And so this is Thursday that we're recording. So then do you get a lot of muscle guarding, and it's much more difficult for a positive Lockmans, right? Like, so when we say Lockmans, basically we're putting our hands behind the knee and we're trying to bring that lower part of the leg forward. And if your ACL is torn, that's going to move a lot more than if your ACL is intact. So, but if there's muscle guarding and swelling, right, it's a lot more difficult to detect, correct?
Yeah, absolutely. And with that pivot shift, they'll probably have some pain on the lateral side of the knee and the joint line that sometimes will act like a lateral meniscus, but really it's just that hard pivot shift over there that can be a sign that they have torn their ACL as well. So there's a few different things, like you said, the loss of range of motion, the immediate swelling, and feeling of instability, all that stuff. Can they bear weight on it? Can they not? And there's ACLs that people can bear weight on it immediately and almost get up and walk off. And then there's the ones that are really bad and they don't get up. So just because somebody gets up and walks off and everything else doesn't mean that that injury can't be in there. I mean, we saw it with our Go Tire at Nationals. She was able to walk and bear weight and all of the things. Still just had that isolated ACL tear in there.
You typically see a lot of swelling with an ACL tear, almost always.
Yeah, most of the time. I mean, obviously there's those isolated cases where people don't swell as much, but typically you're going to see a lot of swelling, especially the next day.
Yeah. Yeah. So like my young man this morning, he didn't have a ton of swelling. And so, my first train of thought was, okay, his ACL. His Lockmans felt pretty good, but I was like, well, it's a couple days out, so there might be some muscle guarding on that. Swelling was not bad. He was tender along the outside of the kneecap. And so that's, once we look at range of motion and a lot of those special tests, we are palpating. So we're poking around on the knee to see, okay, what structures are sore, what is going on there. He didn't have a lot of pain at the joint line on the outside or the inside, but he had a lot of pain along the outside of the kneecap, and the kneecap was a little bit more set to the outside. So, and his valgus varus stress tests were good. His McMurray's was good. Like, so I ruled out meniscus. He didn't really ever complain of locking in the knee. So I was also thinking, okay, it's probably not really locking. He didn't complain of giving out, because I always think locking, I kind of think meniscus. Giving out, I think a little more ACL. What are your thoughts on those two descriptions when people are telling you about their knee?
Well, it just depends. I mean, it's all about all the things together, and so whenever an ACL can come with friends too. It can come with a meniscus tear. It can come with MCL, PCL. I mean, it can definitely get pretty bad in there. And so I'm just relying on my palpation and special tests to direct me. And so, like you said, joint line pain. If we have pain in the joint line, I'm gonna suspect meniscus, but not always. If it's in like the front of the joint line, when it's more, middle back, probably gonna be more apt to think there's could be a meniscus issue here. Sometimes it could just be a bone bruise on that condyle or something, but always going to be cautious of a meniscus there, especially if they have loss of range of motion that is significant compared to the other side. And also, when you're checking the ACL and it's a few days out, and it's not just that, hey, I got them down in the arena check. Um, it's always good to compare to the other side and know what their normal is and
Mhm.
see the difference there as well.
Yeah, yeah, and that's whether we're dealing with an acute injury or an old injury, it's so important for us to take a look, like, okay, what's your other side look like? And so this is what's normal for you. And people can kind of check that at home too. They can just, lay on their back and slide their heels up towards their butt and see if there's a difference from side to side. And they can obviously usually feel a difference. But it is interesting how many people that have knee problems are very limited in their range of motion for sure. And I think we think about a lot of the scary knee injuries, obviously the ACL stuff, PCL stuff, which, the PCL, I haven't seen a ton of those, but I have seen a bullfighter with a PCL tear. PCL is the basically the next door neighbor to the ACL, but it happens a lot of times when you get hit in the shin, car accidents, when people their knees get hit by the dash. Um, that's I've had a hog farmer get hit by a hog and tore his PCL. So they do happen. They're not, as common as ACL, but so whether we're looking at some of those big scary things, the meniscal tears, those kinds of things, or just even some arthritis behind the kneecap. I so many of my people that I see in the clinic, when I work on getting their kneecap tracking right, whether they have arthritis or one of those big scary injuries that we just talked about, the tracking of the kneecap is huge with these knee injuries. And I feel like I can get so much more relief with people when I control that kneecap. What are your thoughts on the patella and the tracking of that?
Well, Um, that's a good question. And so you definitely, again, we're going to be looking at alignment from the hip all the way down and seeing what is causing that patella to get pulled off. And you're right. Whenever it's tracking correctly and everything is working right, and you have proper muscle activation in the quad and flexibility through the quad and hamstring, then um, you're going to have a lot less knee pain and a lot less wear and tear. And so just on those things, I really rely on figuring out why is this happening, and is it because how they're made, and we need to, um, fix how their muscles are activating and their range of motion and mobility in their muscles, or is there something else going on from an old injury that is causing it to be that way? Are the hips off? Do they have a stiff ankle? So some of my patellar tendonitis kids and things like that, almost always I'm checking their ankle and making sure that it's mobile and able to, especially now, able to rotate and things like that. So, and along with their knee being able to rotate, that medial and lateral rotation of the knee is also important whenever you're dealing with those overuse injuries as well.
Yeah. Yeah, and I like to check the hip. And so what a lot of times I'll find with people is, when they come in, their kneecap will have a tendency to move more to the outside of their knee. And usually they have a weak right glute, and a weak hip abductor or external rotator. So the knee ends up kind of like falling inwards, if you'd say, and then the kneecap gets pulled to the outside because the kneecap should move around. It should move well. And so I always check that with everybody. And if it isn't moving well, then I move it and I teach people how to move it. But if your hip is weak and your knee turns in and then your ankle, you get more pronation, it's going to want to pull that kneecap out. So really that's more of a symptom of a problem at the hip and a problem at the ankle, I feel like. And so I go after those people by mobilizing their kneecap more to the inside. And then I go after them strengthening their hip external rotator and their hip abductor. So I go after the glute and I go after their inner thigh muscle. You know, we talked about that a lot. That is such an important, to me, that is like the one of the most important muscles in the body is your inner thigh muscle and your glute. Um, and then I also look at controlling the foot pronation. And so all of those things together can really make a big difference in how that kneecap tracks. And then if I'm suspecting that a lot of their pain is coming from their kneecap, I'll do a tape job on their kneecap. I do we call it a patellar sling where it just like goes under the kneecap and kind of holds it up. And people get a significant amount of relief from that. And or like I'll try to tape it a little more to the inside. So the young man this morning, that's what we did with him. We did a patellar sling on him because after all of my tests, measurements, all that kind of stuff, really felt like the kneecap tracking was a big part of his pain. So I had him do a step up. And, you know, he rated the step up pain about a 4 out of 10. We taped his kneecap. He's like, I have very little pain right now with his kneecap being taped. So is that really the only thing going on with him? I don't know. Time will tell. You know, he didn't have a ton of swelling. He did have, you know, about 25% loss of range of motion. So we're going to keep him taped, keep that kneecap taped. I got him doing exercises that address those issues. And we kind of mimicked having him getting off his horse, standing in that stirrup and coming down after his kneecap was taped. That was quite a bit better. So, you know, time will tell with him, but I really feel like people, if we can control that patella, we can really help people a lot with a lot of pain, whether they think they have arthritis and they're ready for a knee replacement. I still have a lot of those people that if I control that patella, man, they get a lot of relief and we might be able to prolong that knee replacement because it might just be a matter of a lot of the arthritis is behind that kneecap. So
Absolutely. Another thing that I've seen, and this has come from experience, just my own knee surgeries and stuff like that, just getting some of that patellar tendon pain through the recovery process, is a lot of times you'll find people are locked up in their calf and their hamstring in the back. And so mostly probably due to a muscle imbalance, and even the runners that I've seen that have a ton of calf pain, whether we've addressed the hip and everything else, but sometimes you'll see that calf is overworking because the quad is underworking and they aren't able to get that full extension, and the calf is just taking the hit the entire time. And I think that's where my struggle has been with my own calf tightness through the recovery process. I see it in my patients, and then it's like once you get that quad fire and activating like it should, and that full range of motion and extension, you can start to ward some of that off. And that's a great point about the hip stabilizers, stabilizing the leg all the way down. How many times do we activate the glutes and your knee pain almost immediately gets better just from having more stability up high and the muscles of the knee not having to overwork because of that?
yeah, so I always check pelvic stability on people too, like because if your pelvis is out of whack, it's going to change how things work down below. You know, I truly am a believer that pelvis is the foundation of our body. And if our foundation is out of alignment in our houses. Okay. So if your foundation is cracked, we've talked about this, I think, on other podcasts. If your foundation, your basement of your house is cracked or, unlevel, then what happens to your drywall, your doors, and your windows? Your drywall cracks, your doors and windows don't work right. Well, if our pelvis is out of whack, then our knees don't work right, our hips don't work right, our ankle, all of that. Our back gets all locked up. So really to make true long-term improvements on this stuff, we got to make sure that pelvis is neutral because that's the foundation of our body. And, the foundation of like when we're on our horse, that's what connects us to our horse. So it really is a very, very important part of our recovery is making sure that that pelvis is in a good neutral position and we have the right muscles strong enough to hold it there.
Agreed. And if you're dealing with knee pain and you're compensating for that leg, that's gonna take your pelvis out of alignment almost always anyway. So
Yeah. 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 If people are limping, they get their pelvis out of whack. If you have to, wear a boot or a brace for some reason, it changes your gait pattern, it's going to probably get your pelvis out of whack. And so it's all things that are part of the rehab process. And if you have a great chiropractor you go to, great, wonderful, but the long-term solution to pelvic instability is getting the muscles strong enough to hold you there. So if you're finding yourself always having to go back to the chiropractor and your pelvis is always out, that's a pretty much a telltale sign that you need some work on the muscles that hold you there because you got some muscle imbalances always pulling you out of whack.
so what about like riding wise when people are riding their horse and they're having knee pain, what are some of the things you see that are causing that?
Yeah, I think too that can be from pelvic position, I think kneecap pain when they're riding. I think that's pretty common. A lot of people will go with a longer stirrup if they have a lot of knee pain, which I tend to ride a shorter stirrup, but that is going to put more pressure on your knees and your kneecaps. So I think, if your stirrups hang more straight down and you go with a shorter stirrup, then I think you're going to be probably putting a little bit more pressure on that knee. Now, if your stirrups are a little more forward hung and you ride a shorter stirrup, then I think it puts your knee actually at a better angle. So how your stirrups hang can make a really big difference on that. And then too, like, is your saddle fairly new and the stirrups don't want to turn with your foot? How many of us put a old broom, we get a new saddle and we put a broom handle between the stirrups to help turn those. That can be very helpful. I love the saddles that have I think it's called the Hamley twist. That helps basically pre-turn those stirrups so they aren't putting a lot of pressure on your knees. I think the Robbie Phillips saddles do that a lot. I have a Irvine saddle out of Canada that they put the Hamley twist in there. And I believe it was Hamley Saddlery out in Pendleton, Oregon that kind of were the ones that started that. So that's kind of neat to have that carry through to other saddle makers. So, stirrup position I think is huge. But having just having an adjustment there, you can try different stirrup lengths and different stirrup, different saddles might feel a little different. How about on the team roping side of things? Do you feel like what do you think stirrup relationship to knee pain and the event? Do you feel like there's some differences there?
Yeah, I think with your setup, you have to be properly fit in your saddle, and also just sometimes you see people use the slanted stirrups. They say that takes some pressure off of the knees. You might see somebody drop one stirrup lower than the other one. there's a lot of different things that you can try there in order to take pressure off of that knee. So, but I mean, it all comes down to trying to keep everything neutral in the pelvis and then adjusting everything else from there and making sure you have proper mobility and proper strength. Like when I was coming back from my knee and my quads weren't firing, man, posting that trot was wearing me out. It was tough. And my knee would get sore every time I'd post a trot. But if I kind of warmed it up and got the muscles going and everything else, um, man, it was a lot better. And I, when I first started, I dropped that stirrup on that side, just because I lacked the motion. But I didn't really like that. It kind of put me off balance and stuff. So it was definitely a short term deal for me until I could get the mobility I needed in my knee to even me back up. Because when you're dropped off on that side, and you're trying to rope, then you're leaning to that side, you're pulling your horse over, and then everything fades into like if you have say it's your right knee or something, well then you're gonna be fading into your cow off balance like that. On the left side, maybe your horse will get quick on you because you're leaning more off to this side. You're elevating your arm this way, maybe not able to cover the right horn. So just a few things you got to pay attention to when your stirrups. But the more even you can get it and have the proper mobility, the better off you're going to be there.
Yeah. And stirrup length for me is huge when I help somebody. Again, I like to ride a shorter stirrup. And it really depends on your saddle and your body type, but I feel like security in the saddle comes from having those stirrups. The longer they are, the more likely you are to lose them. Now I understand, ropers, you kind of want to have a little bit of a longer stirrup, and do you want toes down, right? Or because like barrel racers, I want a shorter stirrup, and I want you to be secure and heel, if anything, heels down. But ropers, maybe not so much. What do you think
Well,
on that?
I mean, when you stand up, you're gonna have your toes down anyway. But really, even when you're roping, when you stand up, you still want to be balanced. You're not gonna have your toes pointed straight down. You're gonna want as good of a base as possible, and not be leaning forward with your feet all the way pointed down. So, uh, they the guys that you see at the top levels, their posture never changes whatever speed they're going, and so their saddles are fit to them correctly. They have the right amount of seat. They have the correct stirrup length to where when they ride, it's not like they're standing up and leaning over their horse. I mean, they're like straight away, shoulders square the entire time. It never changes. Their body position never changes. If you a great example of Caleb Drickers, he has some of the best body control going down there, and he can throw it a mile. And so I think that that's a misconception is when you see people reaching and getting up over their horse and everything else, that that actually doesn't have to happen, and it almost puts you at a disadvantage when you're pointed down this way. To where if you're set back square in your saddle, you're gonna lead with your horse better, and you're gonna have a probably more coverage of the horns or the calf or whatever if your shoulders are square, and you're gonna have a lot better result that way.
Yeah. And that makes sense. We talk about keeping things consistent all the time, no matter what. And I think if you have better body control, obviously you're going to be more consistent, and you're not going to be sending mixed signals to your horse. So I think that is huge for sure.
Another thing that I tend to see is, and I struggle with this myself, and that is hip mobility. If you don't have good hip internal rotation and good groin mobility to where you can get down in that saddle, so when you go to rate your horse down or you go to stop your horse or anything like that, if you don't have great hip mobility and can't get a deep seat, that also is going to put pressure on that lower leg and cause issues as well. And especially in the barrel racing world when they're running in there. I mean, I've watched it enough now with our evals, and just I'll be sitting at a barrel race watching them, and I can about tell you when somebody doesn't have the range of motion to be able to sit and turn, and lo and behold, you watch them and they can't sit and turn. Well, their horse can't sit and turn, and their horse is on their front end because they can't get set down in their saddle. And then just a snowball effect after that for horse and rider.
Yeah. Yeah. So a lot of tip barrels, if your horse is on your front end, their front end will kind of quit moving or they'll drop shoulders and things like that. And a ton of tip barrels and getting people to sit down, getting them to get on their butt to help their horse stay on their butt, helps with longevity of the rider and the horse. And so it is huge. And if you feel like you cannot sit in on your horse, then you know, we've got to take a look. Is it your saddle? Is it your hip mobility? Is it your back mobility? What is causing that? Why do you, or is it just a habit that you've developed over time to avoid some pain? I've had people that have attended my clinics that um, we get on the horses in the afternoon and they are not sitting down and their horse is panicked and they're like, I don't understand why my horse is nervous. And I'm like, it's because you're flopping around. It's what I want to say. I'm like, let's just try sitting down. Let's try sitting deep in that saddle as you're warming your horse up. And when they sit down, that horse's head comes down, things relax. You're not all over the place. You're not sending all these mixed signals to the horses. And so they chill out a little bit more too. And so, yes, being able to take a deep seat is so, so important. And so if you feel like you can't, we got to figure out why. Why can't you?
And another thing on that too is having, again, we go back to the lower leg and the knee specifically. If you don't have good ankle mobility, it's going to be hard to sit deep in that saddle as well. Because if you're thinking, like, say you for example have shorter stirrups, which is going to put that knee more in a bent position. Well, if you don't have good ankle mobility, you're not going to be able to turn your feet out to cue your horse very well. You're not going to have that bend in the ankle to take pressure off of the knee, because if the ankle only bends so far, then that knee is just going to take the rest of what that ankle is lacking. And then we start to see the overuse and the decreased joint space and all that stuff. I mean, the ankle is another vital part to that motion on the horse as well.
Absolutely. One of the other topics that people talk to me about is, like I'm at a barrel race and there's an older barrel racer that she's like, oh, I think I need a knee replacement. And so we discuss some of the things to get them ready for that. And so one of the things that I find myself talking about a lot at events is make sure that you have good range of motion before you go in for surgery. Because if you have crappy range of motion before surgery, you're going to have crappy range of motion afterwards. And so, like, let's discuss a little bit of like prehab, if you'd say, let's say, yeah, you've had an old injury, you have to have surgery. How can they best prepare themselves for surgery? And the biggest things that I tell people is make sure you can get your knee all the way straight before surgery and try to get as much bend before surgery. Those are probably the biggest things. And then also working on building up your quad muscle, which is the top of your thigh, that muscle, making sure that that muscle is strong as well. And if we can, we also work on the hamstrings, which is the back of your thigh muscle. And that muscle works on bending your knee, and the muscle on the top of your thigh works on straightening your knee. And so those are the big things that I talk to people about beforehand. How about you, Destri? Do you have a lot of discussions about that?
Yeah, I mean, anytime that we have somebody with an injury that their surgery's out a couple weeks or whatever, we're definitely working on range of motion first and foremost, quad activation, hip stability, hamstring activation, and the calf too. Everything that attaches there around the knee, we're trying to get all those muscles activated and firing the best we can so it comes back quicker. And especially the range of motion, like it'll come back so much better if you get that addressed before surgery, like you said. Absolutely get your range of motion down.
Yeah. Even if it's an old injury, lots of arthritis, there's still ways to work on your range of motion while you're waiting for surgery. And so, and it might just be something where you sign up for a consult with us and we get you a program to work on until surgery. And so, it isn't, you don't necessarily have to go into a clinic and 3 days a week for 6 weeks before surgery. If you're willing to do this stuff on your own at home, you just need to know what to do. That is something we can easily do through a virtual coaching, and get you a home program prescribed beforehand. So yeah, doesn't matter where you're at, we can go ahead and get you a program to work on to get you ready for it. And that goes for, too, like shoulder surgery. If you're waiting to go in for shoulder surgery, let's get your range of motion going before you go in there. No matter what surgery, if your range of motion is better beforehand, you're going to have a better outcome afterwards.
Even the people that they're just trying, they're taking injection after injection after injection, trying to prolong that knee replacement. The only way you're going to prolong that is by strengthening the knee and getting your mobility back. And then you would be surprised how much better you feel. There's going to be damage in there. You might be bone on bone. There's going to be some wear and tear, and we're not be able to fix all of that with just an exercise program. But strengthening the muscles around it, fixing your pelvic position, getting the ankle moving, getting the knee rotating again, all of those things is going to take a dramatic bunch of pressure off of that to where hopefully you can perform your daily activities. And it's not going to come all at once. If you've been dealing with it for a long time, it's probably going to take some time to get those muscles where they need to be, and especially up in the hip and everything else and the quad that's shut off from, all those pain signals being sent to the knee, and it's going to shut off. So it's probably going to take a little bit of time to get you back to where you need to be, and you probably won't be 100% with that wear and tear, but the goal is decrease the pain, increase the function, get you strong. So when you do have that knee replacement, hopefully it's further on down the road and you make a quick comeback to it because of your strength, and you're just going to have a lot better outcome that way.
Absolutely. I heard a great quote the other day. It was, take care of your body because it's the only place you have to live. So, if you're having some knee pain now, get it addressed, and don't think, oh, I just have bad knees because my mom had bad knees or my dad had, it runs in our family. Well, there's still things you can do for it. You don't have to just settle for being in pain.
I agree. And again, that is our mission, to try to change that way of thinking of, man, I've hurt for this long. I'm just always going to hurt. Don't think it's the end of the road for you. I mean, definitely, even if we can't help you, try to get some help for sure. And then the other part of that is prevention. And say you have a healthy knee, and we're talking about calf ropers, we're talking about goat tires, those high speed, high collision events, bulldoggers especially. I mean, holy cow, that bulldogging's hard on some knees. You can't go to about any bulldogging jackpot down here, and people are passing around knee braces. I mean, it's terribly hard on them. And again, why the ground is so important, whether you're tying goats or roping calves, running barrels, bulldogging, the ground is so important. We got to watch out for each other on that and making sure the ground is right for these events. But prevention, there's, you're, especially if you're a female, you're going to be at a higher risk for an ACL tear over a male in general. And I would be focusing on ACL prevention. That's what I love to do. I mean, that's part of the performance deal is ACL prevention, whether you're a calf roper or a goat tire or anyone really. I mean, trying to make sure that we do everything we can to try to ward off that tear, and to where you lose time, you lose function, stability. Now, ACL tears are not a death sentence to your career. They're just not. There's a lot of great techniques out there, a lot of great surgeons and rehab techniques now and protocols that we get kids back stronger than they were before. and just as functional. I mean, that is definitely not a death sentence to have an ACL tear anymore like it was back in the day. So, but we want to prevent them. We want those knees to stay good, and that's overall going to help your performance anyway. You know, you're going to be able to do things in your event by doing the ACL preventions. It's not just knee stability. It's dynamic explosiveness, being able to land softly on those knees, being able to absorb a shock, have the stability on one leg to be able to jump off your horse and hit the ground running. All of those things come into play to where, you know, if your leg gives out, that it can be detrimental. Even if your leg doesn't break or tear something in your leg, you're going to go face first, and who knows what else you're going to hurt. So just being able to have the balance and function and explosiveness you need for those events is extremely important. And the game is getting there. The game is getting there now to where you're going to have those things to be at a high level. And if you're somebody who doesn't have all the talent in the world and all the athletic ability in the world, then you're going to want to try and maximize that through proper training.
Yeah. And so we've talked about this as you're developing goat tire program to help with ACL prevention, you know, really working on ensuring that the quads and the hamstrings are both very strong. You know, a lot of times those gals, I want to say gals, but you know, like you said, girls are going to be a little bit more likely to be at risk for an ACL tear. It doesn't mean that they're the only ones, but a lot of times our quads get way stronger than our hamstrings, because so many things in life that we do, we use our quads. But there aren't that many things that we do that really strengthen our hamstrings. So we have to make a really conscious effort to strengthen our hamstrings. And so, you know, Destri and I've kind of put our heads together, and we're coming up with a great, we call it a goat tire program, but you know, it could be for a volleyball girl, it could be for basketball, you know, I mean, really could be used for any type of sports, tie down roping. And so getting that quad hamstring balance, the glute, you know, getting the hip stronger too. You need to be strong to prevent these injuries. And so it really is so very important to the health of your body, longevity of your career. You know, and if you do suffer a tear, you know, it isn't the end of the world, like Destri had said. But we do want to keep you as muscularly balanced as possible to minimize like early onset arthritis. You know, I mean, I do think there's some studies out there that, you know, if you've had an ACL tear, you're more likely to have earlier onset of arthritis because it just changes how your joint works. And so let's try to prevent it and keep you from tearing your body up. And you know, give us a call if you're looking for a program. I think we could really help you out. We'd be happy to.
Yes, definitely let us help you if we can.
For sure.
So, all right. Well, anything else that you have, Becky?
I don't think so. If people have any questions, they can reach out to us on all of our social media channels, YouTube, Facebook, Instagram, on our website. I think our phone numbers are on the website. So they can send us the direct text and catch us at events. Either in Oklahoma or Nebraska for the moment. We're hoping to do a few more events this fall. We're going to have a clinic coming up in Hayes the end of October. We're going to be at the Pink Buckle in some capacity, whether it's just as Gracie's going to be down there competing, so I'll be down there that I can visit with people down there. And so we have Nebraska 40 finals that I'll be at, and I'll be at all the Nebraska high school rodeos. And do you have any other big events coming up, Destri, that you'll be at that people could catch you at?
No, I've just been following my wife around, really. Following her around. She's
So
got my
any
head
barrel race in Oklahoma, good chance
here.
you can be done.
Backyard bird race, jackpot, barrel bash, whatever. You might see me there holding the camera or a bridle or something. So,
All right.
right,
Sounds
but never uh be afraid to reach out and we'll do what we can for you. So,
sounds good. And if you aren't at those places, we can do things virtually. So we'd be happy to help out.
yes, ma'am. All
All right.
right. Well, I will close it out and thank you all for listening. And as always, let your health be the pivot point to your success.